Hi, my name's Sean, and I go to some ACE meetings sometimes. And yeah, so yeah, a little bit about yourself and a little bit about how you find your job.
Yeah, hi Sean. So my name is Steph Chamberlen and I am a primary learning disability liaison nurse. So my job is about helping GP surgeries to meet the health needs of people with a learning disability. So we do that in lots of different ways. So we encourage people to attend their annual health checks, and we support the GP surgeries to make sure they know who to invite to annual health checks by keeping a learning disability register. We help support reasonable adjustments, making reasonable adjustments. So if you need a longer appointment time or you prefer to wait outside of the waiting room, we can work with you and your GP surgery to help make that happen so it's easier to go to your surgery.
Okay. And then how has your job changed since the coronavirus pandemic?
So our job has changed quite a lot since the start of coronavirus. So we now work at home quite a lot of the time rather than going into the office or going to the GP surgeries. We don't see people face to face as much unless it is really urgent. So we do a lot of these type of meetings like we're doing now with the video calls, and we do that with patients and GPs, and we talk to lots of different people and our colleagues via video now.
Yeah. Okay. And what do you think the new normal looks like for your role going forward?
I think we're still trying to work that out a little bit, but at the moment we are looking at the annual health checks with lots of other different people involved to try and work out how they will best work during coronavirus. So we are looking at possibly that some people have their appointments like this on video, or whether some people might still want to come into the GP surgery. So we're just in the process of working out the best way to do that and to keep everyone safe and for everyone to feel comfortable going to the annual health checks. We will probably carry on doing lots of meetings like this via video because they're found to be quite helpful, because a lot of the time we had to travel in our car for quite a while to go to meetings. So meeting like this means we can meet more regularly with people and we don't have that travel time. So I think we will be doing a lot more video meetings with people, and they do seem to work quite well most of the time.
And then how are you finding the coronavirus situation?
I think personally for me, like a lot of people, it's been very strange. It's been a bit stressful at some points. It's quite hard not seeing family and friends all the time. That's probably been the most difficult bit for me. I think it's been a big change, trying to change the way that we live and what we do and how we spend our time. It has been nice in some ways because I've had a bit more time with my husband, who has been on furlough, so he hasn't had to go to work as much. So there are some nice parts about the lockdown and this coronavirus situation, but it's also been difficult at some points as well.
And then how is the new rule on masks on, what is the new rule on masks on the 24th?
Okay, so the government has said that they now want to make it mandatory for people to wear face masks in shops. There will be a list of exemptions like there is for the buses, but I don't think we're quite clear on what they will be just yet, but hopefully the guidance on that should be coming soon. And I think that wearing face masks in shops is all about trying to keep everyone as safe as possible, so it protects other people. When you wear a mask, if you cough or sneeze, some of the droplets that you produce then get caught in the mask rather than carrying on out into the air, into the shop where lots of other people are. So that's part of the reason why there is guidance on face coverings.
Right. Well, thank you for that.
You're welcome. Thank you. It's very nice to speak to you. Thank you for my interview.
Nice to see you and speak to you. Yeah.
And you.